Hello and welcome to our discussion today about heart health and menopause. I'm Jane Robertson from Frank Systems, provider of the employee wellbeing streaming service Ashia, and we're looking at the increased risk of cardiovascular disease in menopause today. Now, we often speak about hot flushes, mood swings, night sweats when we discuss menopause, but there's a really big issue that often gets overlooked, and that's the effect that menopause can have on our heart health. So we've brought together a panel of experts to discuss who is most at risk of heart disease in menopause, the factors that increase that risk, and the different options available to help lower that risk. Laura Coia is a working GP with a special interest in women's health and reducing the risk of chronic disease. Hi, Laura. And Kate Rowe-Ham is founder of the Owning Your Menopause, a website and app focused on maintaining fitness through menopause and midlife. And they work with us, both of them, to provide regular advice and guidance on this subject to users of our wellbeing streaming service, Ashia, along with Kathryn Colas, who founded her eponymous academy, pioneering menopause training for workplaces across the UK. So welcome to all three of you. As always, to everybody who's joined us today, please do post any questions in the comments and we'll do our best to answer them as we go along. So let's meet our guests in a bit more detail now. Laura, perhaps I could start with you and explain the sort of work you do in your surgery and the types of issues that come up, that crop up around menopause for the people coming to see you.
Yeah, so I work in the NHS. I don't do any private work, and I work in an area in the outskirts of Glasgow, with a very mixed demographic in terms of age and social status, etc. So I see a lot of women of menopause age and beyond. I now fall into that bracket myself, so I've got several reasons to be interested in this subject. Yeah, and I'm really kind of keen to help women go through menopause and come out the other end of it and live the rest of their lives with as good quality health as possible, really.
Thank you very much, Laura. And Kate, what sort of sparked your interest in the issues around menopause?
Yeah, hi, thanks so much. Great conversation ahead, really excited. So I experienced not a brilliant perimenopause journey, or sort of the beginning of it. I'm still very much in the throes of it, and found that there wasn't enough information out there to support women. And so did a lot of research myself, and essentially I wanted to try and help other women avoid many of the pitfalls that I found myself in. And lots of the things I managed to find out was how actually lifestyle changes can be massively beneficial at this time. So exercise and diet, and that's where my main focus comes in. Subsequently, I have founded an app called Owning Your Menopause, which basically encourages, supports, and empowers women to thrive at what can be a really, really difficult time in a really supportive community.
And Kathryn, of course, you've been doing training work in many workplaces and with many employers over the years, and we've talked to you on several occasions. The cardiovascular, the kind of heart disease that we're talking about, this particular link today, is that something that sort of you see in the work that you do with employers at the moment? Is that something they're particularly aware of?
It's hardly ever mentioned, really, cardiovascular. Breast cancer is always the first thing that people talk about. And of course, thanks to Kate, when we had that conversation recently, I wasn't aware that dementia has now overtaken heart disease, cardiovascular, as the #1 killer. But people are always surprised when they hear that that cardiovascular disease has been the #1 killer of women in the UK and not the cancers. And it's about, as everyone has said so far, understanding their hormones. Who knew that hormones could be so powerful and affect our lives in such a drastic way in some cases? And so it's about understanding your hormones, understanding your own health, your lifestyle decisions. They really come into focus, particularly at menopause, because you've never bothered about them before. You haven't really needed to. And our reproductive system functions more or less okay every month, and then come to perimenopause, it's all over the place. But we don't realize the side effects that are affecting our health as well, and why we have to think about it in a much more structured way.
Well, Laura, you're the medical expert here. So can you sort of update us as to, as Kathryn was saying there, you know, this risk of heart disease and dementia as well is something that very much affects women, particularly of my age and older, having sort of gone through the menopause. But really, you know, can you lay out what the medical risks are around this at the moment?
Yeah, I think if you were to ask 100 people what they thought the leading cause of death was, I imagine most of them would say cancer. But actually, as we've touched on already, the leading cause of death is dementia. And the second top cause of death is cardiovascular disease, and the two of them have been vying for first place for a while. But and both, I suppose, in many ways have got a similar kind of pathology behind them. It's about thickening of the blood vessels and damage to the blood vessels that supply your heart and your brain. So yeah, I think we really need to be very mindful of all ways that we can approach menopause in terms of reducing people's or women's risk of heart disease, both in terms of looking at kind of what we can do medically and what we can do in terms of their lifestyle. And I think it's very easy with menopause to say, well, your estrogen levels go down, so you know it's all the effects of lowering estrogen that's what causes heart disease. And absolutely, when you've got lower levels of estrogen, you're much more likely to have fat deposition and calcification lining your arteries. But there's lots of other things that come with menopause that are not specifically related to those falling levels of estrogen that can have a negative effect as well. So it could be simple things. So we know that when you go through menopause, your blood pressure tends to go up a little bit with age. Your cholesterol in general goes up, and more so your bad cholesterol. So your LDL cholesterol, which are your bad cholesterol, if you like, the levels of that tend to go up post-menopause, and the levels of your protective, your good cholesterol, your HDL cholesterol, go down. Other things can happen. So with change of mood in menopause, often women might change their eating habits and change their exercise habits, and they might find that their weight goes up a little bit, which also increases your risk of heart disease. And stress as well. There's a stress of actually coping with menopause itself, and you're at the age where you're still looking after your children, but also possibly looking after your parents as well. You're that sandwich generation where there's stress on the generation above and from the generation below as well. Another thing I see quite commonly is women not only struggling with stress in the workplace, but the effects of their menopause in the workplace. And they're at the time in their lives where many women are either in a promoted position, where they've got a lot of responsibility at work, or the other end of the scale is they're in a very manual job, or a very physical job, working long hours and working shifts. Coping with menopausal symptoms in either of those situations can be extremely difficult. And the stress of all of that can further contribute to your risk of heart disease as well. So
I was just going to pick up on that actually, Laura, with Kathryn. I mean, that it is, you know, it is the time of your life career-wise, if you know, are working, you know, employed by somebody else or running your own business, that you very often got to the sort of peak of your powers. And then along comes this sort of, you know, sort of train crash of menopause that can really derail you.
Yeah, it's the silent career killer, really, and it's multifaceted, because every day you're facing different symptoms. And if like me, you didn't appreciate that this was perimenopause until you were postmenopausal, you had no idea what was going on. So you might have been going to your doctor on multiple occasions with different symptoms. And for me, that was anxiety and depression. I was diagnosed with depression and referred to a psychiatrist. I later self-diagnosed with bipolar, which I thought was absolutely nuts, until I spoke, pardon the pun, until I spoke to a professor about this, and he said, oh no, it's so common in women going through menopause. Who knew? And we need to be more aware of things like that. So, you know, if bipolar is a very serious medical condition, but for me, I could have been days when I had so much energy, so much creativity, I could do anything you like, so much energy, and then I would crash, I would hit the floor, and I would feel so depressed. I'd look in the mirror. Who am I? What am I doing here? I had feelings of suicide, and it was a terrible place to be, and I wouldn't wish that on anybody. So it's understanding your body and how it works, and those symptoms and the hormones within it, and how powerful those hormones have been, and, you know, to create the situation within my body, the physiology, that I wanted to commit suicide, that I had these feelings of worthlessness, and it was related to my hormones. And you explain that to me. You can explain that to anybody. Nobody knows, certainly generally in the population, we don't know how powerful our hormones are. And that's having an effect on heart health as well, as we've heard from Dr. Laura. So it's an awareness and understanding about our dietary requirements, our exercise requirements, but
and let's pick up on
most
that
of all, how all that is affecting us and our families around us.
Yeah, and Kate, obviously picking up on that, you very much focused on the fitness and the diet, and you've realised that, changing the way you eat, changing the, whether you lift weights or, trying to keep mobile, keep your bone density and your muscle strength going in midlife is so important, isn't it? How have you sort of changed your lifestyle, and how are you now helping other women to do that through your app?
Yeah, I know it's really interesting listening to everyone's different, different stories and different menopause experience. And I think kind of picking up on both Laura and Kathryn, I definitely think one thing to say is like prevention is better than cure. So I know we talked about coming into menopause, and sort of that's the time when we realise that things are changing. One of the things I think that's really important is that we make sure these conversations are really inclusive for anybody that watches this now, anybody that watches it later, that this is a conversation for women from the age of 20, so for everybody from the age of 20. I know that 51% of the population go through menopause. In my personal opinion, it affects 100%. So I think these are brilliant conversations to have, because Laura will obviously be able to vouch that there's a lot we can do in terms of prevention of things like osteoporosis, of CDV, cardiovascular disease, and just making little tweaks and changes there. And then interesting picking up on what Kathryn has kind of said about her own menopause. I do think that a lot more women are presenting, and again, Laura, you're the medic here, so do call me out on it. Is that anxiety? Is that breathlessness? Is that depression? Again, Kathryn, my story was very similar to yours. And you get to a place where you aren't putting yourself first, you're catering for everybody else's needs. You feel alone, you feel isolated. So obviously exercise, eating healthily, like that's just so not on your radar, and that's where I think we see that decline. So that's basically where I was like, okay, what do I need to do to turn this around? Because I do not want to live my life like this. I want to be seen and I want to be heard, and I've got so much more to give here, but how do I go about doing that? And so that was when I looked at focusing on my internal health, on my heart, on my joints, and realizing actually some of the things I was doing was exacerbating many of the symptoms that then show up. So strength training, as you pointed out, brilliant for anxiety, brilliant for heart health, brilliant for bone health, brilliant for mental health. So you've kind of got that way of working out that is really good. Diet, eating 3 wholesome, delicious meals a day. What we see, and I know Laura, you might see it, and Kathryn again, we see women who are going through menopause and they have this sort of inevitable weight gain, and so they undereat and they over-exercise. And I think what we often think is exercise has to be this heart racing, sweaty, crazy thing that we have to do for about an hour if it's going to work. And that is not the case, and we can get a really lovely effective workout with weights in 20 to 25 minutes. But we also need to eat and nourish our body, because we need to make sure our heart has the fuel, the oxygen is going around the body, the blood is pumping, and that we aren't raising, again, coming back to that stressfulness of not eating or over exercising, the cortisol levels rising, and then therefore more stress, and putting us at a greater risk again of type 2 diabetes, heart disease, all those things that also interlinked. So that, I think, for a lot of women, what I want them to do is to strip it back and not see exercise and diet as something that is intimidating, that needs to be overcomplicated, but also to know that there are people out there that can support them on this journey, and they get it, and they understand the challenges that everybody is faced with as they're navigating this time, and that you can thrive and you can get there if you just implement little lifestyle changes.
Laura, just as sort of coming back to you in terms of seeing women in a surgery, as we've all discussed already, that not every woman would know that a symptom might be a symptom of menopause, so they're not necessarily going to come and see you. But But are there certain things from your point of view that you would advise women sort of, you know, in their, I don't know, late 30s, early 40s, who might be coming into this sort of period around menopause, that they should be thinking about earlier than perhaps, you know, you and I have done in the past?
In terms of lifestyle change, or in time?
Yeah, and in terms of how
they're going through.
Yeah, and reducing this risk, if we can reduce this. I mean, can you reduce the risk of heart disease?
So I suppose I like what Kate was saying about how it's not just about trying to make these changes when you're going through menopause. And I think we need to remember that there are women who will go through menopause anything from the age of 18 or 19 right the way through to mid-50s. It's not common to go through menopause that early, but it happens. And it's often missed when women go through menopause, or if premature ovarian failure, it's often missed. And I think the best thing we can do is actually make this a generational change and talk to young people and young girls in school, not just young girls, but young people, and just make sure that they see exercise and being physically active as a normal part of life. And I think the big thing as a woman, of like some of the changes I've certainly made going through menopause at home, I kind of feel like my kids are now just growing up in a house where their mum exercises, where they do eat a lot of different fruits, veg, nuts and pulses in a week, where we do talk about our feelings, we do go out for a walk, we do all have different ways that we each manage our own stress. And I think these are all things that if you get people doing it when they're young and get them into the habit of doing it, they will naturally have a lot of these healthy behaviours in place, so that they're not going to their doctor in their late 40s and saying, oh, I'm just a mess, I'm going through menopause, I've got all these symptoms and I don't have any healthful habits in place. And trying to put habits in place when you're feeling low, suicidal, really exhausted, it's really difficult. But if you've got those habits in place already, the chances of you getting to that point are slimmer, and you've then got something that you can automatically go to try and help make you feel a wee bit better, and also help reduce your risk of chronic disease in the longer term. So I think it's about getting these things early, and I think it's about, I would start by what you can add in rather than what you can take away. So people always say, well, just write me a list of things that I shouldn't be eating and a list of things I shouldn't be drinking. And I'm like, well, that list would be very small, because there's nothing that I would suggest you don't eat or drink, really. But if we start by, adding in some more vegetables, adding in some different fibres, adding in some pulses, adding in some physical activity, adding in some other kind of healthful behaviours, and then you won't have as much space for all the other stuff, really, and you won't go reaching for the chocolate and reaching for the sweets. And yeah, I think adding stuff in is more important than taking it away, I would say.
I know we've had a comment, and thank you very much from Trek Stock for making it. But making the point that sometimes menopause is brought on by having treatment for cancer, and so that you might be. It's almost like a shock, you've gone one day from being this person to suddenly being that person. And so there are times actually when you can't pre-prepare, can you? And no. It comes as a very much immediate change that you've got to kind of deal with. And that must be very difficult.
Yeah, very difficult. And I think especially in that situation where someone's also going through chemotherapy, women will often come in and their chemotherapy will have been successful, and everyone around about them's like, well, this is amazing, it's worked, you're well, you've beaten your cancer, and they're sitting there menopausal, life changed overnight, feeling awful, and having that feeling that they have to be smiling at everyone and rejoicing. And yeah, it's absolutely life changing overnight for people. And again, they're in a situation where actually putting some of these healthful habits into place is difficult. They're not going to have a lot of energy. They might not have their appetite back. It is a different situation, and one that actually we don't support women enough through.
Kathryn, you were saying that you very much were at the, really in the depths of despair by the sounds of it, with what you went through. What did you do? Did you make the small changes that Laura was talking about, or have you learned over a period of time what worked and what didn't?
Yeah, I think eventually I put on 2.5 stone and couldn't work out. So that made me feel worse about myself. And so where do you start? And I just learned more about menopause. I probably went to the extreme. I joined the British Menopause Society. I went to medical conferences because I just had to get a handle on this thing called menopause, and why don't we know enough about it? My dietary what I ate and drink was quite moderate. We've always been a family that's eaten properly, if you like. Yeah, we had processed foods as well. We probably had a mix of both, but predominantly it was mostly fresh food, fruit and veg as well as meat. We've decreased our meat intake, eating chicken and fish more, and definitely more fruit and vegetables, to consciously more fruit and vegetables. And how did I lose that weight? I started to go swimming. Swimming is my exercise, and walking. I don't do the gym. I don't do it well, or I don't enjoy it. Let's say I probably do it as well as anybody else. But yeah, walking. Got a beautiful forest surrounding me, so we're walking on the forest. But swimming for me, everybody says when I come back from a swim, you're a changed person. And I also belong to a local choir. Singing is good for the soul. And so those things, but swimming, certainly, I stopped getting on the scales, and I was going into yet another dress size higher. But the swimming, I just kept pounding away every couple of 2 or 3 times a week. And gradually over a year, it was another person in the pool that said to me, do you know what, Kathryn, you've lost weight. I think, oh, have I? And that made me feel really good. And then I started noticing with my clothes that there was more room in them without having to go up another dress size. And so I just carried on with the better food. I think it's becoming more consciously aware because of everything else that's going on in your life that's affecting you personally, with the symptoms of menopause and how you're reacting to your family. And then you are more consciously aware of, well, what can I do to make some changes that's going to help my life? You keep reading about better nutrition and exercise, that they're good for you. But what if you don't like doing that? I think we're just going for a walk around the block is going to be helpful. Finding some green space, and which can help you feel good. If water makes you feel good, whether it's just looking at it or being in it, then get involved. And it's what works personally. And so I suppose I have my regime now. I'd love to go swimming more often, but I don't often get the time. But that's always the thing that does it for me. That's the magic pill, the swimming.
And Kate, obviously I'm assuming that before you sort of went into perimenopause that you liked keeping fit anyway, did you? And how do you deliver that sort of fitness routine now? Has that changed for you? Have you added things in and taken things out of your routine to try and keep your heart healthy and your body healthy too?
Yeah, I love that. It's a really good question as well, actually, because I think a lot of the time people can get caught up in where they are, and I as a personal trainer, and I actually don't then think I expect everyone to have that level of fitness immediately, or not that level of fitness, it's everybody has to start somewhere. So I can tell everybody my journey and I can tell everybody what I do, but actually I think the most important thing is for anyone watching, anyone listening, anyone who wants to offer advice to somebody, is that we all are unique in this whole menopause experience. Everyone's journey is different. And my biggest thing and my biggest takeout is what I want women to know is that I've been doing this, yes, for however long, 3 to 4 years, and I didn't actually come from like a great level of fitness. Like, I liked sport and I enjoyed it, but I did it for all the wrong reasons. I did it only really as a weight goal that had an aesthetic benefit. I had no idea actually that the way I was working out and the way I wasn't probably nourishing my body was actually having a detrimental effect again on my bone health. I have got a diagnosis of osteopenia in both my hips, so it's really important that I make sure that I do eat well, lots of calcium, vitamin D, and that I do strength train. But I think not comparing ourselves and not overthinking it is really key to anyone starting, because for any woman that is experiencing some of the crippling symptoms of menopause that is stopping them from moving, it's really, really hard to start, and that is not to be underestimated. And I think we really have to factor that in, that you are unique. You will start your journey where you are and you will improve. And Kathryn, I loved your point, and I think it's really key in that it took time, because I think we're very much as well living in a society where we think, right, going to do this. I'm going to go and do 0 to 5K and I'm going to run 5K by Friday. That is not going to happen. Or I'm going to lose a stone and I'm going to lose a stone in 2 weeks. That is not going to happen unless, and then that brings us to Laura's point, you make these severe life restrictions that you can't live by. It doesn't become sustainable. And you just end up in this more cyclical sort of cycle of juggling life. You're hungry, you're not enjoying your exercise, and so it just becomes all too much. And what we really need, women, partners, kids, everyone, to focus on for that person navigating menopause at that time is to support the person going through that, and say, look, you're doing really well, you've just started, you've done 10 minutes walking today, well done. You had protein at lunch and dinner, well done. Breakfast was a bit of a slapdash and it didn't work. That's okay. But just to slowly build and to allow yourself that opportunity, because I think that my biggest message that I want to get across to all women, and I'm loving it, and I know we're going to come on to it, but we haven't talked about HRT yet, is that we all have the opportunity to thrive at this time. Right now, when this call is done, what can you do to help yourself? Go out, go for a walk for 10 minutes and make that the beginning of something that you're going to do every day. Think about what you're adding to your plate, that protein, that, all of the things that you can then do, and do that today. But don't put a time limit on that. Like, just let that grow and let that grow naturally. And if you get out for 5 minutes, well done. But I think really, really important to remember that everybody was once potentially where you were, obviously that journey being unique. It takes time. Don't overthink it, and please do not compare your journey to yourself to anybody else. And I think I can talk about my own fitness journey, but it might help people to know that I was in a really low place and now I'm not. But what I do is going to be different to what the next person needs. And I would hate for nobody to start because they felt they had to do what I was doing.
Yeah, very good advice there, Kate. And Laura, exactly what Kate was saying there. I was just going to come on to the HRT question, really, is, as we're focusing here on heart health, I feel like it should be heart, health, and menopause, because actually there's 3 things going on here. But, can we lower the risk of heart disease in menopause for ourselves? And how does HRT fit into that picture?
Yeah, so there is evidence that HRT, if it's given under the age of 60 or within 10 years of menopause, can lower your risk of developing heart disease. We know that's clear. We also know that all these other lifestyle changes that we're talking about can have as big, if not greater, an effect on your risk reduction of ischemic heart disease after menopause. But HRT should be something that you're talking to your GP about. What it shouldn't be, and what often happens, is it's the only thing the GP talks to you about. So if someone comes in to me and they're asking about HRT, that's my opportunity to have that conversation, but to also say, well, if the reason you're asking about this is because you've got a family history of heart disease and you want to reduce that risk, why aren't we talking about your blood pressure? Why aren't we checking your cholesterol? Why aren't we checking your sugar? Why aren't we asking about your family history of other illnesses like diabetes? So I think it's really important to have that conversation about HRT, but we can't forget all the other bits and pieces that help reduce your risk. And I think that's what often happens, is the conversation is now so focused on HRT that we forget about these other things that are just as important, if not more so.
Out of interest, Kathryn, Kate, do you use HRT yourselves?
Yes, yeah. Like Kate, I was diagnosed with talking to a professor about menopause, and I was fit and healthy. I'd got my weight down again, fit and healthy. I was given a bone scan. He said, well, I've got the bone scanner in the next room, Kathryn, let's have a look. And I was osteopenic, and I was horrified. Well, how did that happen? And so I was put on HRT. I was 62 at that time. And the professor said that my bones, it would help bone regrowth. And I thought, yeah, okay. And he was absolutely right. I didn't believe the process. I'm not medical, so why should I? But I am now back in the normal range. I'm no longer osteopenic. I'm still on HRT, and I'm estrogen, progesterone, and testosterone. And you'll have to cut my right arm off to get me off it. I feel fit and well. Whether that's because of the contribution from the HRT, I don't know. But why go off it when something's working? It's a supplement, as far as I'm concerned. It's supplementing my estrogen and any other missing parts that may be there, and it's supporting that. And we would do that on a normal daily basis. If you were at the doctor's, you were diabetic, you were short of certain vitamins and minerals, you'd be supplementing those. So why not at menopause?
Is Laura, is HRT suitable for everybody? Obviously there are some people that just don't want to take it, that they're not quite convinced about it. Well, what should those people do? But is it also, can anybody take it, or do you have to be a bit careful about who has it?
There's very few people who cannot take HRT. There's very, very few exceptions. Certainly not all types of HRT are suitable for every woman. So it would very much be one that you need to discuss with your own GP to work out which is best for you. But there's very few people who cannot have any form of HRT at all.
And what about post-menopause? Because I think you said ideally you'd want somebody to be starting before they're 60 or 10 years post menopause. What about if somebody hasn't taken it? Is there anything else that you can do at that stage to try and help your bones and your heart?
So to start off with, there's no downside to starting HRT like Kathryn did in your 60s. But what we can't say is that you'll get the same benefit in terms of cardio protection if you're starting HRT in your 60s. But there's no downside in terms of heart health. And the advice that we give someone in their 60s in terms of looking after their overall well-being and reducing the risk of heart disease is the same as it is in their 50s, 40s, 30s, 12s, and even when they're in their teens. It is what we've talked about already. It's things like looking at what you're putting into your body, so looking at your nutrition, what you're eating and drinking, looking at how physically active you are, looking at stress in your life and trying to manage that, and even things like looking at how socially connected you are, making sure that you've got good support. There's lots of things that we can look at. But it's the same no matter what age you are. What you might be able to do physically might be different at 62 than it is when you're 22, but the principles are the same. And I would go back a wee bit to what Kate was saying before about, setting yourself a rigid goal as well. And I think I often speak to patients about, why don't we forget about setting a goal of a stone weight loss, or forgetting a goal of I want to be able to run 5K in the next 6 weeks, and move the conversation to, why are you doing it? Why do you want to make this change? Why are you here? And often people say, well, I want to improve my health. That's my goal, is to improve my health. I want to be around to look after my kids when they're older. I want to be a good role model for my children. I feel I'm not being very productive at work at the moment. I would rather be more productive at work and be a more valued member of the team. So these are all, you're talking to them about their values and what's important to them. And that's a much stronger motivator than a goal that, if you reach that goal, great. If you don't reach that goal, you're going to end up feeling really, really bad about yourself. And actually it's going to be detrimental to your health. So it's about thinking about why you want to make these changes and using those values as a way of navigating your way forward. So you're not kind of aiming towards, it's not like a point in a compass where you're aiming towards an end goal here. It's about going in the right direction. And that way you can't fail, because as long as you're making small changes that are getting you closer to where you're heading, you can't be anything but proud of yourself, really.
Yeah. Kate,
it's very much. Can I say, sorry, I was going to just pick up on something Laura said then, because I just think that also that's really key. And I think one of the things for women as well is being an advocate for their health at this age. And I think that actually we can really empower ourselves around our future health by kind of understanding what is going on. And to the point about HRT, I do take HRT. I had a really high dose and it wasn't actually working, and that was on the patches, and changed it. But what I do know is if I've got my physical health, and I know that everything I'm doing diet wise and fitness wise is right, and then if there's a blip, I know it might be my hormones, or back to Laura's point, like it might be something else. Because I think, again, it's really important to remember, and again, I might have totally changed sort of the subject, but obviously the NHS are quite stretched in terms of diagnosing menopause. You've got a 10-minute kind of window, but they have to rule out, again, Laura, please do correct me, anything more sinister. And so I think it can be a worry when sometimes menopause is just sort of given that diagnosis without those lifestyle changes, and then they're not asking women to sort of look at their health and work it out. And it is, as I say, going back, it's a really good opportunity to kind of go, okay, my bowels, is that normal? Isn't that normal? The heart, the fluctuations in the heart or the breathlessness that you might be experiencing, is that anxiety or is it anything more sinister? That weight gain, am I pre-diabetes or am I not? And trying to strike up that relationship with yourself so that you can advocate for your health, and then go to your GP if something isn't quite right or hasn't quite worked out when you started the HRT, and say, this, I don't think maybe is menopause related, and then at least you can kind of get all of those other things diagnosed. I mean, I know I had, and I'm very honest about it, I had a few issues with my stomach, and I've recently been diagnosed with serrated polyposis syndrome. So, you know, although the HRT didn't help with one of the bloating or the symptoms that I was experiencing, there was another reason and an underlying thing, and I think that we have to be mindful of that. And so I guess getting to know our bodies, because again, Laura, Kathryn, Jane, I mean, you'll probably agree also that when you're given HRT for the first time, you have to tweak and change that. It can take 3 years to work out what it is you actually need. But if you are exercising and eating well, you have your toolkit that can be your constant go-to when things aren't quite right.
I think what I would say to that is, don't assume anything's normal, and don't assume anything is your menopause. And because that's not your job, that's my job. It's my job to tell you whether you should be worried about that or not.
Yeah.
So I think any of these things you should be making an appointment, and even if it's over the phone and just talking through. If we want to see you, we'll bring you in, we'll see you, we'll do whatever. But it's not your job to work out whether that's something you should be worried about or not. That's my job. I'm happy to do it. So
do you think, Laura, more? Sorry to interrupt. Are more GPs now? Obviously, I know we talk about menopause a lot more now, obviously in the last few years, and all the media coverage and everything. You know, would most women or most people going through menopause be able to go to a GP and the GP will understand about menopause? Or, you know, because you sometimes hear somebody saying, oh, I don't think my GP really got it, and they weren't very helpful. You know, a GP's up to scratch on it mostly now.
Yeah, I think it's really difficult, because obviously I can only comment on people I know and people I work with. Certainly think we make a real effort to try and keep ourselves as up to date as we can, and we're very lucky. And I think most areas in Scotland are really lucky that the local menopause specialists, although they might have long wait times, certainly in Glasgow, the local specialists, if you write to them with a question or you want a bit of information, they'll write back really quickly, and they're an amazing source of support. I would imagine that most, it's a sweeping generalisation, but the female GPs probably deal with menopause more than male GPs. So I think it is potentially more difficult if you don't see a lot of women of menopausal age to be as up on it as someone like myself who sees a lot of women.
And actually,
so I think things are improving. I think education's improving. I think we're aware that we maybe weren't as proactive as we should have been. So yeah, I think things are moving in the right direction. My worry is that it moves too much in the direction of just prescribing HRT and just dealing with the medical side of it, and we forget about all the other stuff that's just as important, if not more so. And I think that's what we need to be mindful of, really.
Yeah, and actually, Peter, thank you for your comment, Peter Abrahamson, who's one of our experts and helps people with their mental health, has said, obviously, you know, men need to be aware of this too. And I'm sort of coming to you really, Kathryn, for this, I guess, is that, you know, there are a lot of men in the workplace, a lot of men are managers, they might be managing women who are going through this, and therefore what should they be thinking about at this stage of a women's career?
Yeah,
in terms of the help that they could offer.
Yes, as it can be the silent career killer, as I've said, but there was one great story I heard one day of a woman that was experiencing some symptoms, and the type of work she was doing meant that she was wearing a lot of uniform. I think it was going through COVID, so she had facial coverings as well, and she was unable to do her job properly. And so she realized she was going through menopause, went to her manager, and his response to her, I think, was brilliant. And I think this is an excellent first stage for anyone. And he said to her, I know nothing about menopause, but I will do my best to support you. I don't think you can ask for more than that, because women are experiencing stress and anxiety. They're being diagnosed with mental health situations when it's really the hormones. And because the people that they're reporting to aren't necessarily experts, it might be HR or something. HR, perhaps because of absenteeism, HR are writing to their GP for a report, and they've gone to their GP, perhaps not explained themselves properly, because sometimes it's difficult when you're going through menopause to say exactly what you want to say, and she's already been diagnosed with depression and putting on antidepressants, and that report goes back to HR. So they're already going down a route that is discriminatory, really. It's not supporting them in the way they should be supported. And I'll never forget one workshop we did where somebody in the audience came up to us afterwards and said she'd been signed off for work with depression, on antidepressants. She didn't want to be in this situation, but having now found out more about menopause, she said, I know what's wrong. It's menopause. So she was going to take that different route, go back to her doctor and say what she needed to say, and take a different route to recovery than the antidepressants. Sometimes antidepressants and HRT, or whatever combination of medication that's prescribed to by the doctor, can work. We're not ruling out antidepressants altogether, and that's down to the diagnosis with their doctor. But just to automatically assume that because she's presenting with depression and anxiety, it's the mental health side of things, and they're not investigating whether it's hormonal related. I think that's what we need to be more aware of. Yeah. And a lot of, you can get that support now.
Yeah, and a lot of workplaces now, Kathryn, are they're starting these sort of talking groups about things like menopause, aren't they? And that can be very helpful, can't it? Just to get a group of people together who have an interest or can share their experiences and swap notes with each other, almost, to know that you're not going insane on your own.
That's right. Even in the situation we are here today, the audience can now go back to their workplace and say, guess what? We've just been on this talk about menopause. What does anybody know about it? So you just start the conversation. It's just being able to talk. That's not necessarily with your immediate colleague, with your best friend, but with your line manager as well. And in fact, with your own team, with your whole team, asking the question, look, I've just done this, been on this menopause program. I need to share some information with you. And they will either look aghast, or they will say, yes, please tell us what you know. And they'd be so interested to hear what you have to say. So that's the starting point. And then they can start saying, well, how can we support our staff? How big is the organisation? What can we put in place to help you? Or how small is the organisation? And still, what can we put in place to help you? And there's a variety of different measures.
Yeah, I think we have, for example, I've got lots of knowledge about menopause, but I still can't help a patient who's in front of me until I say, well, what symptoms are you having? Tell me more about your menopause, and what can I do to help you? What are the things that are causing you most trouble at home? What's causing you most trouble at work? And what can I do to help with that? Mm-hmm. So they're the same two questions that their line manager or HR should be asking them, or how does it affect you as an individual? And what can we do to make life better for you in the workplace? Yeah. So yeah, knowledge is a big part of it, but those two questions still always need to be answered, no matter how much you know about menopause, I think.
And not to be scared of it, really, not to be scared of what's being said to you, and be open to saying, I don't know how to help you, but I'll find out how I can. Yeah.
And Kate, you've been into some very male-dominated workplaces recently, I think, haven't you? And so you're getting the message out there to the rest of the population, which is fantastic.
Yeah, that threw me. I went to give a menopause chat last week at a company, and it was brilliant. I mean, it threw me, but it was brilliant because it actually meant that instead of saying, you and necessarily talking to all the people in the room, actually it was the men. I was like, your partners might be experiencing this. Have you thought about your partners? Do you, or your employees, or anyone, or your colleagues, anyone? I think it's I think that for me was a great moment to kind of be able to talk to the men in the room and raise it, because I think also, Laura, you're still saying those two questions. Are some taboo symptoms that come with menopause, and it might not be necessarily the ones that are impacting that person in the workplace, the hot flushes, everything else. But, you know, relationships can come under a massive strain. You know, your sex life, your intimacy, all of those things, you know, can impact then someone going to work if things aren't quite, you know, stable in the home. And I think that's probably a really difficult conversation to have with your line manager. You know, I'm not great because, and actually it's because you might feel invisible at home and invisible in the workplace. You know, if they're just not presenting those normal symptoms or the symptoms that we most talk about. So I think, you know, as you're saying, having these places and these spaces within the workplace, menopause cafes, and actually that is the one thing, obviously you have to slightly sell my own app, but that's obviously the one thing I've got on the app, which is brilliant, is we have a community space where it is monitored 24/7. And there is a GP, so that any help somebody needs, they get their answer, and they can get their answer quite quickly, which I hope then relieves the stress, you know, on other GPs when there isn't that facility. But equally, the wonderful thing is when a woman says, "Oh, this," somebody else from the community comes on and goes, "Oh my goodness, that happened to me," and suddenly the relief for that other woman to know that she's not alone. That is so powerful. It is, you're all having a unique journey, but you're not alone, however it's sort of panning out.
Yeah, and men can be very perceptive as well, and they often notice things happening in their partners before the partner wants to or accepts those same things happening, and that can sometimes cause some distress, because if he's done his homework, he's gone online and put all this information in there, and he's going, "Oh, it's menopause, I must tell her," and she's going, "No, go away, don't want to know." And so that can cause some distress as well. But sowing the seed, men are very perceptive, even in the workplace as managers. They can see it. They may be happening at home, and they can see it in their teams, and they have a better understanding and empathy. Most of all, the empathy is there, and that they can help channel what that person needs to. They might not get it all right, but at least it can start the ball rolling and helping support that team member. And so they stay in work, and they become more productive again because somebody cares. And that makes so much difference.
Well, ladies, we're almost out of time, so I'm just going to bring it back to what we sort of started off talking about, which was this kind of sort of unspoken link between menopause and heart health, and I'd love to sort of end really with, you know, any kind of message that you'd like to leave with the people who've kindly joined us and listened into the conversation today, which I think has been fascinating. So, Kathryn, perhaps I could sort of start with you. You know, you're very much focused on workplace training, going into employers, trying to help them with this, what is a massive issue really, for half the workforce, and especially as we want to keep a lot of older women in the workforce as well now. What would you like to leave people with today?
I think if you recognise the subject of menopause, you've joined in this conversation today. I think it's about getting professional help in to help your managers, to help everyone in the workplace understand what's going on, because we hear so much about HR being targeted and say, we need to know more about menopause, get something. So they blindly go onto the internet, grab some information, say, there we are, and chuck it at everybody, for want of a better term. And it's not always the right information. So it's always best to get professionals in and to help get them through that period, through those challenges, and get everybody more productive.
Excellent. Kate, what would you like to add?
I just think I would like everyone to think about how they would like to live independently for as long as possible. And that doesn't mean leaving partners or doing all of that sort of stuff. It means being strong for as long as you can. And actually, regardless of the type of menopause you've had, regardless of your age, that actually we need to move every day. We need to move for, you know, for our overall health and well-being, to reduce the stress. So just move every day, and it's never too late to start, and pull everybody on that journey with you. You know, bring people along for the ride, because actually you're so much stronger together. And I know we touched on, one of the things, reaching out and talking to people, talk to people, share, because people will share back with you. Phone that friend, go for that walk, take them with you, but it's never too late to start. And yet, for how long would you like to live independently and strong?
Brilliant. And Laura, what should we be thinking about in terms of this kind of link, and what we can try to do to reduce the risks in our mid and later life around heart disease?
I think similar to Kate, I think it's about looking at the whole picture and taking a holistic approach to this, and thinking about not only fixing the hormone levels and trying to replace some of the hormones that you're lacking, but also looking at your physical activity, your stress levels, what you're putting into your body, how socially connected you are. And about, as an employer, it's all very well, getting experts in and talking to your staff, but if what comes out of that is that they need access to certain foods, or they need access to time to be able to go out for a walk in the middle of the day in their lunch hour rather than working through it, whatever they're asking for and whatever they need, if you can put some actual structures in place within that work environment that supports them to make the healthy changes that they should be making, I think that would make a massive difference. So you're actually helping them on that journey.
Yeah, brilliant. I think that phrase "stronger together," I think that's what we've kind of figured out through all this, isn't it? Is talk to each other, talk to people in the workplace, talk to your partners, and most importantly, talk to your GP if you are concerned about anything as well. Fantastic. Thank you so much for your company, Laura, Kathryn and Kate. This conversation was brought to you by Frog Systems. Our wellbeing streaming service, Ashir, is a complete on-demand platform full of personal human stories, expert opinion, workplace-focused webinars just like this one, and signposted support and resources to support your employees through all the different life challenges that they face. So do visit our website for more, where you can sign up also for a free trial, and do follow us on social media. But thank you so much to our guests, and thank you importantly for watching. I really hope that this conversation helps you to bring some changes, positive changes to your workplaces. Enjoy the rest of your